This year's 2012 United Nations report on the Millennium Development Goals rated MDG 4 on reduction of child mortality and MDG 5 on reduction of maternal mortality in the bottom positions. The UN warned that if the government and stakeholders did not immediately strategize on what to do, meeting the 2015 target will remain only a dream for Kenya and a majority of African countries. However, while on a courtesy call on the Standard Group, the newly appointed United Nations Children Fund representative to Kenya committed to strengthening their collaboration with the government to help tremendously reduce maternal deaths and infant mortality by 2015.
We will strengthen our collaboration with the government, but we understand it's not only with government. We need to do it with communities themselves. We need to do it with the civil society and the private sector to actually create the focus on that very challenging area.
With the majority of Kenyans in informal settlements and rural areas unable to access health facilities, UNICEF says it will work closely with the government to reach vulnerable groups across the country. Group's Chief Operations Officer Sajvit Chana called on the organization to work towards ensuring children under 5 have access to basic needs.
We still need to reach out to those vulnerable groups that exist in different parts of the country. When you look at the disparities and the vulnerabilities, you see a picture where some areas are still falling behind and are still lagging behind, and we need to have an equitable approach.
As public and the government, we need to do a lot more in terms of policy, in terms of sensitization of everyone, and we need to do a lot more, so that the children can get access to the basic needs, and then when they grow up, they can actually realize their dreams.
Despite Kenya's poor record in meeting the 2 Millennium Development Goals, a recent World Bank report rated Kenya top in its attempt to reduce child mortality. The report said only 44 of 1,000 children under 1 year die, while 75 out of 1,000 children under 5 die of childhood complications and diseases. UNICEF says it is working harder to reduce these numbers. For KTN Live at 1, I'm Angel Katusia.